During preclinic practice, students are expected to work with their fellow classmates, with a clinician, and sometimes working independently in the dental unit, practicing the various skills that we have been learning over the course of the term. And sometimes students have difficulty with the instrument transfer or using the high volume evacuator and air water syringe during a practice session. They're not really sure what they should be doing when they're working on their own. So during this brief video, I'm going to demonstrate to you what you can actually do to practice these skills so that you are making the best use of your time. Now, just a couple of things. When we go through the procedure, I'm not going to be wearing a dental mask simply because it will be difficult to hear what I'm saying. I also don't have the barriers on. So you would have a treatment unit that has been properly barriered because that's a skill you want to practice. But I haven't put the barriers on for today's procedure just so that they don't make a lot of noise and interfere. So we're going to practice instrument transfer and also briefly some high volume evacuation and use of the air water syringe. When you're practicing these procedures, you always have to have your protective equipment on. I'm going to be wearing my protective eyewear, and don't forget the sequence that you should be putting these things on as well. You would position your mask, then put your protective eyewear on, wash your hands, and put your exam gloves on. So again, I'm not wearing a mask just so that you can hear what I am saying as we go through the procedure. So I have my tray here. I'm assisting a right-handed operator. So my instruments are going to be sequenced on the tray from the left side of the tray to the right side. Remember, with your mouth mirror and the Explorer, whatever you happen to have on your tray, it might be a pigtail Explorer, it might be a shepherd's hook right angle Explorer, you always want to put the Explorer in the first position and the mouth mirror in the second position. And this way, when you go to select the instruments from the tray and bring them into the transfer zone, you don't have to be thinking about which instrument is going to be used by the operator in one of their hands. They should be properly positioned, and the operator will take them from you, and they will be in the right hands. So we're starting our procedure. We turn our light on. Make sure that the light is focused down towards the client's legs, and then just rotate it up to the oral cavity, and we'll just pretend that we're working in the mandible, the lower arch. So I have the operating light directly over the oral cavity. So again, I'm practicing by myself. I don't have anyone to transfer the instruments to. I know that the operator always wants to start the sequence with an examination of the area that they're going to be working on. So I'm going to select my Explorer and the mouth mirror from the instrument tray. When I pick up these instruments, I want to make sure that I'm holding them opposite to the working ends. So I will select them using my pickup fingers, which are my forefinger, my middle finger, and my thumb, and bring them into the transfer zone. And I'm going to make a V towards the client's chin. You'll notice that I'm holding these just below the client's chin over their chest in a V so the operator would be able to take the instruments. And when I come into the transfer zone, I'm very careful not to go over the client's face. I come around them so that I don't prick them with one of the instruments. So you want to be able to do this very safely. So practice this several times, coming in, getting the right position, making sure that you have a V, and making sure that you're in the transfer zone so the operator is going to be able to see you. So keep practicing that so it feels very comfortable. Just keep practicing, picking up those two instruments and bringing them safely and efficiently into the transfer zone. Okay, so now the operator wants another instrument. So I'm just going to pick up the next instrument on my tray. Again, using my pickup fingers, my forefinger, my middle finger, and my thumb, I'm holding the instrument opposite to a working end. Now, I don't know which end the operator might want, but just for practice purposes, just make sure that you are opposite to one of the two ends that you have. Come into the transfer zone and hold this again below the client's chin and over their chest. Don't get in the habit of holding the instrument back towards you because the operator can't see if you're ready with that instrument. So they're going to use their peripheral vision to see that there's an instrument ready and waiting for them. So you have to be in the transfer zone. So extend your pinky finger so that you're ready to take the instrument from the operator. So that's basically the position you want to be in. And then we'll put that instrument back, pick the next instrument up again, using the appropriate pickup fingers, coming in safely into the transfer zone, extending the pinky finger. It shows I'm ready to take the instrument, and then I can transfer this to the operator. In the meantime, I'm going to be taking an instrument from them and transferring the new instrument to them. When you are waiting for that transfer to take place, make sure that the working end is oriented correctly depending on whether you're working in the mandible or the maxilla. So generally speaking, if we're working in the mandible, the working end is pointed down, and if we're working in the maxilla, we would point the working end up. So I just stay in the transfer zone, waiting for the operator to come out of the mouth so that we can effect the transfer. Now let's say the operator wants something like the dental dam forceps. The dental dam forceps are slightly bulkier, probably going to be a bit easier to do a two-handed transfer with this. So I'll just pick up another instrument. I've got this instrument in my left hand. I'm going to come in with the dental dam forceps. So what we're going to do here is the operator maybe takes this instrument, they give it back to me, I'll come out of the transfer zone, go into the transfer zone with the dental dam forceps, which are being held in my right hand. I'm using a palm grasp to hold this. The operator would take the dental dam forceps, they would use it in the mouth, give it back to me, and then I'll come back in with the other instrument. So we're basically we've got one hand in the transfer zone, we move the other hand out of the way, and then we just, again, come back with the other hand. So a very simple exchange happens. Now, if we assume that the operator wants maybe a cotton roll, again, I'm going to use a two-handed transfer for this. So I pick up my instrument. So I'm in the transfer zone. The operator gives this instrument back to me. I come in with the cotton pliers, with the cotton roll, which I'm holding in a palm grasp. And then I'm going to come back in with this other instrument. So one thing you want to observe is the fact that I stay close to the transfer zone. I don't back out. I've got to stay close so the operator knows that I'm ready. So I've got one instrument, come in to transfer the second instrument, and then back again. And again, you can do this many, many times, working in various areas of the mouth. So I've just got the client position for the mandible, but you can change the position of the dental chair and have the client's head up, so they're working in the maxilla, and try approaching the area from that particular angle, because it does change things a little bit. When you are changing the position of the dental chair, make sure that you adjust the light. Turn it down so that, again, it's focused towards the client's legs, because when we make it a position change with the dental chair, we don't want the light to go into the client's eyes. So as soon as you hear the operator say, oh, I'm just going to adjust the chair, you should automatically have your hand up to adjust the light. When the chair has been repositioned, bring the light back into focus. And again, we'll start off with our mouth mirror and explore, come into the transfer zone, come back out, and then you can go through just any procedure in your mind. Just pretend that we're working through a restorative procedure, and you're coming in with the various instruments as the operator requires them. Always get in the habit of picking up with the left hand. So I don't want to see you going from the right hand to the left hand and into the transfer zone. It's not very efficient to do that. So try to get in the habit of picking up with the left hand. And put the instrument back on the tray where you originally picked it from, so that you always know where your instruments are situated. Again, if I just do one more two-handed transfer, pick up the cotton roll. So I've got an instrument that the operator is using. They've given it back to me. I come in with the cotton pliers, and I just come out of the way with my other instrument. They give the cotton pliers back to me, and then I bring the instrument back so that they can take that from me. So we're just going back and forth. So I'm staying nice and close. I'm not coming out of the area. I'm staying very close so the operator can see that I'm always ready with an instrument. So that should just give you a bit of an idea of how you can practice the instrument transfer skill safely. You want to be focused on how you're selecting the instruments from the tray, where you're putting them back down, how you approach the transfer zone. Are you coming in safely around the client's head? How are you holding the instrument? Can the operator take it easily because you're holding opposite to the working end? Do you have your pinky finger extended so that you can receive that used instrument? And then putting the instrument back on the tray in the position that it was originally placed. So if you can practice that skill over and over again, you're going to find that your skills will develop very quickly, and when you go into restorative clinic, you're going to feel far more comfortable.